Okay, so today I want to talk to you guys about the rotator cuff. So this is another common, thing that we see in the clinic. Obviously, people with shoulder pain, what's going on? Do we have rotator cuff tear? Do we have impingement? Do we have some kind of tendonitis? What's going on with the shoulder? So I wanted to kind of educate you guys on exactly what the rotator cuff is and the job of the rotator cuff. So this is a little model that we have in the clinic that we like to use. So this is actually the right side. So this is like my right shoulder here. It would actually be, sitting on the back. But this is the front of it, and then this is your clavicle or collarbone sticking here, and then this would be a posterior or back view. So this would be as if it was looking from the back. So looking at it from the back, the top muscle that you see here is going to be one of your rotator cuff muscles. This muscle is called the supraspinatus muscle, and its main job is to abduct the arm. So that means to lift away. So when we lift our arm up and away, that is one of the jobs of the supraspinatus. This muscle that you see here, this bigger, that takes up most of the meatier part of the bottom part of the shoulder blade, whole thing is called the scapula. This muscle that you see here is actually going to be called your infraspinatus. And that muscle is going to be mostly in charge of your external rotation or movement of the arm going out this way. Okay. And then right underneath that, you can see this little smaller muscle right here. This muscle is called the teres minor muscle, another one of the four muscles that make up the rotator cuff. And its primary job is to do a little bit of external rotation as well. So just like that infraspinatus, it kind of aids with that. So that external rotation. And then looking back to the front, this muscle that you see here that sits in between or in the front of the scapula is called the subscapularis. And that muscle is going to be primarily your internal rotation and your adduction, which is the movement of coming in towards the body, like you're adding it to the body. And so that is going to be your four main rotator cuff muscles. On this model, you can also see this bigger muscle right here. This is actually the teres major muscle that comes in and attaches at the shoulder. And this little piece right here is part of the bicep that is cut off, and the long head tendon kind of coming in. Sometimes with shoulder injuries, there will be issues with the bicep long head tendon, and that's because it's part of it right here. So sometimes it's associated or sometimes requires repair whenever you have to have surgery. So this is just kind of a good visual that you can see where these muscles are located and how it affects the shoulder. So one of the main things that the rotator cuff does in order for good movement of the arm and the shoulder. So this would be your arm here, or the humerus bone. And so when you lift your arm, when you lift it up, the goal of the rotator cuff is to work together to take the ball that's a ball and socket that sits inside of this, what we call glenoid fossa, that you can't really see because of all the tendons here, but that's what the ball sits inside of. And when you raise your arm, the goal of the rotator cuff is to work together to pull the ball down so that it kind of depresses it. So as you raise it up, it doesn't grind on these tendons and these structures that pass through underneath this fossa part right here. So when you raise that arm up, the ball is supposed to go down and leave some space at the top so that things aren't grinding. So when you're having pain when you raise your arm, that tends to usually be a dysfunction of the rotator cuff because it's not doing its job. These muscles are weak, and so the ball is not being depressed when you're raising it up, and therefore you're pinching those structures in between those two anatomical pieces. And so you get what we call an impingement syndrome. And that is something that we see very commonly, in the clinic. Typically it gets better pretty quickly. We just try and avoid some overhead movements, and we're going to strengthen up that rotator cuff. And once we do that, you tend to see, that you're able to raise that arm up a little bit higher, less pain. One of the things to think about too is tendonitis. So this is also a common injury. So tendonitis is basically just going to be inflammation of the tendons of the rotator cuff. And typically what happens with this is that's like an overuse injury. So you see this really commonly in patients who, maybe they're a painter and they're got that arm overhead, or, tennis servers. things that are going to have this repetitive overhead movement, that's going to be that overuse injury that, you know, they may be doing overhead painting for hours in a day. You know, maybe you decided to do some DIY projects at home during this quarantine, and you decided to do some painting, and maybe you started having a little bit of shoulder pain the next day. Well, you might have inflamed some of those tendons because you're not used to having that arm up there for multiple hours or, you know, of the day. So, that could be kind of what's going on. It will tend to get better, give it a little bit of time, take some anti-inflammatories, and, you know, there are specific muscle exercises that you can do. So certainly come see us. We can definitely help you with that. Another thing that you can see sometimes with shoulder pain is called bursitis. So you can't see it on the model here, but underneath the tendons, they have these little fluid-filled sacs called bursa. And, essentially what happens with that is that those get inflamed. Again, you know, if the rotator cuff is not working efficiently, you're getting grinding, things are degrading, and you're going to get some inflammation. And so sometimes it's these fluid-filled sacs that get inflamed. And so again, you know, those anti-inflammatories are going to help with some of that inflammation. Of course, your doctor is going to be able to prescribe those things to you. And then we can give you the exercise program and the manual therapy that you might need in order to overcome some of these dysfunctions and disorders. And then of course there's strains and tears. So strain being, you know, just a stretching, overstretching of the tendon, versus having a tear where you actually have a tear of one of or more of the rotator cuff muscles. So the most commonly torn one is actually going to be this supraspinatus. That is the main culprit of your tears. We also will see, you know, involvement of the infraspinatus and subscap, but most often is going to be that supraspinatus tendon. Keep in mind too that just because you have a tear doesn't always mean that you're going to have pain. If you have a complete tear of the rotator cuff, you don't have any nerve connections at that point anymore, so you might not have any pain, but you might not be able to raise your arm. So those are going to kind of be some signs that, you know, you might need to get some of that looked at. But that is just kind of a lowdown on some of the rotator cuff, you know, dysfunctions and injuries that we treat, and that you may see with some of these issues with shoulder pain. And like I said, you know, just a little bit about that rotator cuff. So if you have any questions, give us a call at the clinic, 871-7878. We'd be happy to help you.